This is an introduction about collaborative learning and practice for student nurses studying with the School of Nursing and Midwifery. CIPP is a project that's been introduced across the Southwest, following on from introduction in various parts of the country. When you go into your placements, you are going to likely, as time increases throughout your programme, to be going into areas with CIPP in place. The aim is to improve student experience by mentoring and supervising students in a different way to they have been before. What it does do is stimulate students to learn more and develop quicker and advanced communication, management, leadership and teaching skills within their placement experience. The reasons behind doing this is, one, obviously to improve the student experience, but it's also about workforce development. Students, we know, return to a place that they've enjoyed to start their first registrant jobs. So just to say that when you're learning, actually a large part of your learning will take place within the practice setting. But also there is the part where we do demonstration in clinical skills and our discussions that we have with you as students. And the other part is about teaching and supporting others to learn. And if you look at this learning pyramid, then you're going to see that actually learning in practice, discussing and teaching others is the best way to learn. So how does CIPP actually work? We have groups of students placed in a ward or a clinical team, more than they would normally have, because what we want is the students to work and learn together. So in groups and teams, using coaching techniques with each other, which we are bedding into our programme, supervised by the registered nurse and the support workers who also use coaching techniques to enable and develop your learning. The registrant takes a step back. They will observe and use the coaching techniques to facilitate and promote your clinical reasoning and clinical decision making, your learning and development. The student is in front. So what students can then do is work together to work as a team, coach each other, working alongside each other, making decisions about the care that the patients are to receive for the shift that they do, with the support of the registered nurse, deciding what needs to be doing, prioritising, deciding what actions need to be taken, what needs to be undertaken for the whole patient. Therefore, you're going to start working more holistically and understanding more holistically the patients that you're caring for. I've mentioned the word coaching a couple of times. So we are looking at reflective models of coaching, and you'll find that when you're being coached, you're going to be asked these questions. What is it that needs to be done for a group of patients or one patient, for example? So what's happening now? So what needs to be done? What's happening with the patient? And what's happening with you? What are your understanding? What you might need to know more about? So if a patient has to have a procedure undertaken, do you know much about it? Do you need to know about it? Do you need to get somebody to come and do that? Do you need to be coached through doing it? That kind of thing. Options. What needs to be done? What sort of choices do you have, or do you have with the patient in negotiation them, and then actually deciding what needs to be done? So that's the way it is. What I'm going to do now is hang that on some examples for you. So a little bit more around, what are you thinking, what your goals are, what your options and alternatives. And if we've been doing this briefing with you, or will be doing this briefing with you, when you go into CIPP clinical care areas, we'll talk a little bit more about how to get the best out of thinking in this way, and talking and stimulating each other to work and think in this way as well. So what are the benefits of using coaching skills? We found students do rapidly develop their confidence, and coach each other along, start to problem solve together, taking responsibility for the learning as well as taking the responsibility for the patient that they're caring for. Students, generally speaking, actually get a lot of satisfaction working in CLIP environment. We do know it doesn't suit everyone, but it is about team working. And as nurses, you are going to be expected to work in teams and maybe people that you don't necessarily like or get on with. So it actually enables that to happen in a learning environment, really, with the support of the registered nurses. It does build critical thinking and clinical reasoning and decision making, and it also helps you to improve reflection, what went well, how did it go as I expected, type of things. What it also does is it increases motivation as well in the staff, but it increases people's self-esteem, and our students that are in their third year that have been involved in CLIP will say that they feel better equipped to take on the role of registered nurse. So we use coaching to enable goals to be set, to be realistically planned, organise and coordinate learning as well as the activities that you will be doing with patients. It enables you to work together with other students, senior and junior students or students of the same stage as you, to work as a team, working through problems and solving them and making decisions about patients. So currently, many students have been involved in being mentored, and the difference between mentors and coaching is you work alongside mentor, and it's usually follow me, watch what I do, see what I do, I'll tell you things, you can ask me questions, I'll ask you questions, but essentially I'm leading. Coaching is more about asking this question, stepping back, enabling the students to learn, observing the student in their work, but also to understand the whole clinical area, the whole clinical team, and the whole of the holistic approach for patient care. So, if you're going to be working in a ward environment, you're allocated to a team on a daily basis, usually a specific section of the ward, not the whole ward, and the remaining of the ward functions as normal. Each of you will be allocated total responsibility for one or more patients depending on their experience. So a year one student, you would expect to probably be responsible for one patient but work with the rest of the student group there to give care and help and assist them with their task. If you're a second and third year, then the increased number of students you will be responsible for. What is also expected is that you would access the pathways in relation to the patient's journey, and therefore you will get to work with specialist nurses, go to other departments, but it's all very much related to the clinical environment that you're in. Now, this is a current practice with students, but what it's saying is that whilst you'll be managing day-to-day care for patients, you will also have those learning opportunities to pathway out. We bed weekly reflective sessions into CLIP, so all the students will come together with the clinical nursing team, often led by the clinical manager, but sometimes led by the students, where you will look back at what's been going on in the previous week on a set day each week. You'll be looking at what went well, what didn't go so well, and what things could be done to move things forward, maybe for individuals or maybe for the students as a group. Quite often you'll find that the university link nurses will be coming along for those weekly meetings to join in the sessions with you. Generally speaking, CLIP doesn't occur during the night shifts because of the small number of staff, and sometimes maybe only one or two registered nurses will be available, and to have a large group of students under their supervision as well is quite difficult to achieve, and therefore you will do night shifts, but you won't be in the CLIP environment. Other things that may well happen is you may have days that you work with your named mentor, as you wouldn't normally work with them on a daily basis within CLIP, and therefore you can review with them how you're doing and how you're getting on. So you might have a mentor day. You may also find that the clinical area has structured some specific study days for students doing CLIP peppered throughout the placement experience, so that also will be part of it. So if you're working in a community team, you will work on a one-to-one basis with your registrant nurse, but on occasion you might work with each other using coaching, facilitating in the same way. But essentially, students would come together at the end of the day to share their experiences with each other and reflect and learn. So it's what have you learned today? What have you been doing today? What else do you need to learn? What would better equip you to give the care to that individual next time? So those discussions and that opportunity for peer reflection together can still be created in a community team if you rather than in a big clinical ward environment. So as I've just mentioned, you will have a named mentor allocated to each student, but you wouldn't necessarily work that frequently with the student. This is what's classed as indirect supervision. You'll get feedback from the RNs who you work with, who will be supervising you, to form the basis for your assessment. Your mentors will set goals. They will meet you for formative and summative assessments, as they normally do, but we stretch the mentoring to mentoring's been available to students 40% of the working week. So there's always somebody who understands the needs of students as mentors, who are available that people can talk to, or you can talk to your individual mentor, but you will not be working that frequently with your mentor as commonly has been in the past. So what have we been finding? And in order to summarise, it puts the student at the centre of learning. Students start to understand the whole patient approach to care more than they have done before, rather than doing just little bits. Oh, do you want to phone up the discharge team, or do you want to organise this? You actually make those decisions yourself, and you make those calls yourself. You talk to the medics, you talk to the therapists, you talk to the relatives. It is your patient, your decisions. You're giving the care under the supervision of a registrant. Some of our students feel this is much like what they call real nursing, and as I said before, they feel better prepared for registrant practice. Patients rather like it because often, if you're working with patients, they actually get to know you better as their students. And also because there are more of you around, if you're working in a ward environment, then the students will get more attention than, the patients will get more attention than they might perceive before, and they actually really feel that this is a good way for students to learn about them, and we've received feedback of that. We've noticed professionalism and confidence and working together as students actually strengthens your experience and starting to shape you into the professional of the future a lot quicker than we see in previous student development pathways. What this does is engages students really early on in the concepts of leadership management, designing workload and practice regarding which stage of their placements. And this has often been something that students haven't really got to grips with until they're in their third year and just starting to learn, and often go into registrant practice still feeling underconfident about their leadership and management skills. We're seeing leadership management skills that you would expect in a third year final placement student in end of first year, mid second year students. So we know that it is enriching your development. So what we do to prepare people for CLIP, so many of our placement providers have been running CLIP for about a year. Part of that preparation is about the whole team so that they own it and they understand their roles and responsibilities. That's right down to healthcare support workers. And there is structure to your placement experience. There are weekly meetings. You can pathway out and you can have those golden hours of learning or days where you come together and look at what you've been learning about. Go away and have a look at, say, diabetes, for example, and then come back and share with each other. So you start to actually link that practice, what you're doing in practice, to the underpinning theoretical knowledge that you need to have for caring for people with diabetes. Sometimes students have felt they need to be there at all times because they're caring for a group of patients, so that then they may be missed learning opportunities. But still, you need to still take those learning opportunities and build it into your development plan, or on a ad hoc, something is happening and you need to go and do that, because the wards and the clinical teams can continue to run whether you're there or not. So supernumerary status still exists, but sometimes students feel it's really important for them to continue to be there with their patients as much as needed. So do think about that you can take those learning. As most of you have experienced working in teams where there have been staff shortages, you may feel there's some vulnerability, that they're all very busy and you need to get on and do that care. And it's important to ensure that people know that you're not sure about maybe being with a group of patients when somebody's doing a lot of other activities. The registrant might be pulled to do activities elsewhere. The placement support system, the placement leads in our trusts are very aware that it's important to ensure that the students feel that they can still function comfortably within the development of the roles and experiences that they're having. What happens is sometimes students who aren't doing so well, and they actually, or feeling uncomfortable about their learning, can be identified earlier on and improve. And that's really good. And sometimes the students will actually help and move each other along for everybody to move together and develop together. However, students can fall out with each other. Students aren't necessarily used to working with each other, and we've got to think about professionalism, professional practice, and what that actually means. And again, clinical teams are aware that sometimes it's putting you to work together with a group of patients isn't something that some of you may have experienced before. Sometimes clinical areas have redeployed staff because students are there, and this is a challenge. However, again, every placement provider has signed up to this and has signed up to enabling the students to be appropriately supervised. And when these sort of things happen, then this needs to be escalated up so that it can be addressed. So the NMC have published new standards for student nurses for the professional of the future, and what is required is for students to be ready to be supervisors at graduation. So we are working towards that. So you will be prepared to peer teach in your introduction to practice. We'll be doing activities around that. When you're doing clinical skills, you will be expected to keep logs and reflect and use evidence of competence to meet the domains, especially leadership and management domains. It fits in really nicely with that. And also people who are mentors and who are supervisors are also being developed to use coaching techniques to enable this to take place as a transition. So what we do from the university perspective is we facilitate. We have a dedicated website and shared resources toolkit, and the links for that are on Poppy. We support initial staff training. We can attend weekly debriefs, and we participate in any evaluation activities. So you will actually see more people from the university taking an interest and taking part in the CIPP experience. This is just a briefing. You will, in due course, have more information and also have more understanding of CIPP. When you're going to be allocated to a CIPP area, you will be invited to meet with the team and the other students at the start in order to set ground rules and have a greater understanding. So I'm hoping this briefing has given you some insight into what to expect, and hopefully you'll look forward to it. 99% of the students feel they get a lot out of going into CIPP, and all our placement providers are increasing the number of CIPP areas that they can provide for students.